So as you know, today is the World Immunization Day, and on this occasion, Hyderabad Elite Doctor Club, here and say clinic, and Nathan's Learning Forum, and Utage Child Development Center will welcome you all. And today, all are we can say all diggers from the Hyderabad Corporate Hospital, and Dr. Lavanya, Dr. Zoster, sorry, Dr. Aftab, and then Dr. Sudha, Dr. Suresh, Dr. Sudhir Kumar sir, and list is very long, but without wasting much time, we welcome all on such an academic feast, and we'll go ahead. Over to you, Lavanya.
So Dr. Lavanya is an MBBS from Vellore, and she has completed her clinical posting. She's working as consultant immunologist at University Hospital of North Midlands, UK, and she's an honorary senior research fellow health economics, University of Birmingham, and she's into clinical practice, primary and secondary immune deficiency, adult allergies, adult and clinical immunology laboratory. Welcome, Dr. Lavanya, with us. We are really happy and privileged to have you with us.
Thank you so much. I'm assuming, will you be sharing my slides, or will I be sharing my slides?
You can, ma'am, if you want. I have made you a co-host. Just a second. Yeah.
Before ma'am takes over, the few very minimal etiquettes and the rules we have we request everybody to make sure that their thing is on mute, and any questions, please put it on the chat box. We will be recording the session also, so do ask a question. Even if we cannot answer it right now, we will be putting in the comment section once the link is uploaded, which will be the job of Dr. Garima from Here and Say. Over to one and only Dr. Lavanya. I hope you're ready for that.
Clearly, I am one and only. Hello, thank you for having me here. I'm assuming this is because I have the misfortune of being Adi Ashish's classmate from med school. We both from batch of 93 Vellore. So I've been in the UK for quite a while now, and I practice as a consultant immunologist in the NHS. So Ashish asked me to talk about vaccinations in adults. And the question is, why is this important? Because we concentrate so much on childhood vaccination. Is it really important to concentrate on adults? I'm going to give you a little bit of a background on what vaccines do and why they are important. And then I'll also talk to you a little bit about whether it's only children that need to be vaccinated. There are quite a few slides that I'm going through, but hopefully they will be quick. And I'm quite happy to take questions in the end. Also, I wasn't sure what sort of an audience I was speaking to. I'm assuming this is a mixed audience, so there might be some immunology there, which is quite basic, so just bear with me. But if you have any questions, I'm quite happy to take them in the end. So what do vaccines do? Just like infection, they teach the immune system to fight bugs, okay? Except that they are much safer than wild-type infection, and that's the point. That's why we give people vaccines. And they generate an immunity that is quite effective against a wild-type infection. So what do I mean by that? So if I give you vaccine against, say, chickenpox, and you then develop chickenpox, then basically the body will fight the wild-type immunity quite effectively. That's the point of vaccine. And they generate, very importantly, and the significant reason why we give people vaccines is they generate a good immune memory. And that's what we need to fight bugs in the future. So I'm going to show you a few things pictorially about what might happen when you actually have an infection, but it is a similar thing that happens with vaccines. So for example, because everybody likes to talk about COVID now, so once you have a viral infection like SARS-CoV or any other, the first thing that happens is that the innate immune system gets activated. So one of the cells of the innate immune system is shown here, that is a dendritic cell, but you have other cells, like say the neutrophils or the NK cells. You also have other components of the immune system. You may have heard things like, say, complement system. You may have heard of the toll-like receptors and various other things. But whatever, at the end of the day, I mean, the main thing that happens with the innate system is not only that the bugs are fought, but they are then shown to the adaptive system. And the adaptive immune system is the important system that's like the all bells and whistles, the fantastic immune system that we have. because it induces memory. And that's what we want to do with either infection or vaccination. So what then happens is the adaptive immune system, which comprises mainly of the T and B cells, will get activated. And once that gets activated, you have a memory T cell and memory B cell, which we then use to fight infections in the future. So the point of having a vaccine is that you're trying to generate IgG antibodies, you're generating memory B cells, you want some memory T cells, CD8 or CD4, and you're keeping all of these in the bank because that's what you need to fight an infection. So this is like a graph pictorially showing you what might happen when you have an infection. Okay, so here you have this arrow here showing you the purple lines, which show you what happens when you have an infection. So the virus gets in and it divides like crazy in the beginning because the body is still trying to figure out what's going on. And then,
sorry to interrupt, madam, your slides are not being changed. We can still see
my apologies. Where are we then on the slide?
This is just the introduction slide. We are still on the introduction
I
slide.
do apologize. I had so many good graphics.
Yes, yeah. Now we are on health and economics slide. Okay.
So this is what I was showing you before.
Okay.
Very good custom animation, which obviously is not working. So then you have the virus enter. It activates the innate immune system, including the dendritic cells, neutrophils, etc. But the dendritic cells then take the viral antigen, show it to the adaptive immune system, which is the T and B cells, and then you have memory cells generated, which is what you need from vaccination. My apologies that you didn't see that before, but this is the point of vaccination. So you want people to develop some IgG antibodies, memory cells, which are B, and T cells, which can be CD4 or CD8. And CD8, as you probably know, are the important cells for viral specific responses. So why are vaccines important? So if you look at this graphic, it shows you what happens when you have an infection. So the purple line is the antigen. So it could be the virus, or it could be a bacteria, it could be anything. So when you actually have a virus enter your body, then in the beginning, the body is still trying to figure out what happened. So it is still trying to figure out who this is, what sort of immune response I can load. And in the meantime, so basically it takes a little while, a couple of weeks, before you start seeing specific antibodies against this virus, and also specific memory and specific T cells being generated. And that is the point. Actually, most infections, within that couple of weeks that it takes for the body to figure out what's happening and start generating a response, most pathogens cause a whole load of trouble. So the point of having vaccines is that they will pretend to be the actual bug. So when you give somebody like the COVID vaccine, for example, you're giving them a spike protein. So the body thinks that it is the COVID vaccine, COVID virus. It generates a response, and all that response is then waiting there so that when you actually see wild type COVID virus, then the body's already got a response ready. So that is the point of a vaccine. It reduces the time to adaptive immune response. So you already have this memory bank generated by the vaccine, so the body doesn't have to then start figuring out what bug it is and what sort of immune response should I generate. And the antibodies, they basically neutralize the virus, so they neutralize toxins before they cause damage. They help other immune cells eliminate the pathogens more effectively. So you need to keep these antibodies in the bank, it's very important if you're able to vaccinate. And CD4 cells are important. We said memory T cells, when they are important for certain infections, then CD8 cells are more important in virus immunity and so on. So, I mean, all this is fine. I mean, you can let people have infections. What's the big deal? If you let people have, say, a little bit of chickenpox, most people don't die of chickenpox. Well, some people do. Children don't. So, and lots of children get chickenpox and they all get over it. So what's the big deal? The big deal is actually that infections have a huge amount of a broad impact on individuals, on healthcare, on the health economy, and in fact on societal economy, really. So if you have a child who's poorly, not only is the child using up health resource, it's difficult for them. They probably end up, if they have a meningococcal meningitis, for example, and they've ended up with long-term disability. But then you also think about the carers. It stops maybe parents working. Parents have to take time off work. costs us a lot in healthcare. But actually, you can prevent all that by giving a vaccine, which is quite cheap and very, very effective. Hopefully, I don't need to inform this audience about how good vaccines are. I mean, some of these are data from the UK. The top screen, which is the one from pertussis vaccine, showing the huge impact that the DPT vaccine has had on pertussis infection. And then MMR, which was introduced in as the licensed vaccine came in and the MMR was introduced, how the rates of measles fell. These are reported estimates from for polio in India, and the amazing vaccination program that India led for the last few years, and how it's completely decimated, or in fact almost eradicated, the number of polio patients in India. So vaccination is super effective, and it stops the devastation that most infectious diseases cause. And this is, I mean, because we cannot escape COVID, I thought I'd include another slide on COVID. And these are cases in hospital admissions from Israel, which fell rapidly once the COVID vaccines booster doses had been given. So, should only children be vaccinated? Well, we certainly jam-pack a child's immunization scheme. So we give them tons of vaccines. This is the Indian Association of Pediatrics immunization schedule for children. You must be familiar with it, but we give them tons and tons and tons of vaccine. But there's a reason why we concentrate so much on children when it comes to vaccines. And that's because children are far more vulnerable. They have underdeveloped immune systems, and therefore any bug that gets in can actually take root quite quickly and cause them more damage because they're not able to put up the proper type of fight. And then they also don't have very good physical barriers to infection. So their mucosal systems are not very well developed. The skin barriers are not very well developed. So they are vulnerable in many ways. And also, you know, they have siblings, and siblings go to school. And as we all know, schools are just basically repositories for disease. And, you know, once children go to school, everybody gets ill. So it's one of those things. So children, of course, should be prioritized for vaccination. And also the benefit that they get is really amazing. But adults need to get vaccinated too, because some diseases are far more significant in adults. So you have like HPV, basically, and shingles, for example, causes lots of problems, especially with pain and things in adults. Influenza affects adults a lot more than children, but it does affect children as well. COVID-19, as we know, doesn't seem to affect children very much, but can cause devastating consequences for adults. The other reason why you need to give some vaccines to adults is because the effect of childhood vaccines can wear off, actually. So we found that in the UK. So we had to actually introduce an extra pertussis vaccination in adulthood because the levels were falling, and there was another spike in the incidence of pertussis as people got older. And tetanus, for example, we all know that people may need a couple of extra doses of tetanus as time goes on. And also some adults may be more vulnerable. We have elderly people who can be more vulnerable to some certain types of infection, immune deficient people who I look after on a regular basis in my clinic, but basically they will need a little extra care when it comes to prevention of infections, and people with other diseases that can compromise their immune system, such as diabetes, heart, kidney, liver, respiratory disease, etc. But I think one of the things we need to be aware of is that some vaccines are not particularly useful in adults. Okay, so you have different things, like, for example, I took the example of Hib conjugate vaccine here. So people get Haemophilus influenza infections, and even in the UK, people sometimes tend to give them the Hib vaccine, but actually the Hib vaccine is a vaccine for Hib capsule, which encapsulated organisms only affect children. The adults usually get infections with uncapsulated Hib, and therefore giving Hib conjugate to Hib does not to adults does not stop them getting Haemophilus influenza infection. And then some vaccines have limited effectiveness, like BCG, Pneumovax, for example. It's a sugar vaccine, a carbohydrate vaccine, so it's not a very effective vaccine. It only is effective against invasive pneumococcal disease or sepsis, but it doesn't stop people getting chest infections. Anyway, so that was a whistle-stop tour of what the vaccines do and whether you should be giving vaccines to adults or not. And I hope I've convinced you, which I'm sure you already have been convinced before you came here. Vaccines are very, very important. They train the immune system to recognize and fight bugs before they can actually cause disease. But the wider implications are not just for the individual. They are for the wider health economy, for the society as well. So, I mean, they have incredible benefits. But yes, adults need to be vaccinated too, because there's not only weakening of childhood responses, but certain conditions can make adults more vulnerable. We've just alluded to a few of them. And some pathogens are more relevant to adults than to children. I know there are lots of other talks on what vaccines adults get, but I hope I've made some inroads into convincing you about vaccines. Happy to take any questions.
That was a very wonderful insight, Lavanya. I'm very much sure there would be a couple of questions. Time is short, so anybody right now, quickly, we'll take 1 or 2 questions. Otherwise, we'll move on to Aftab. Is Dr. Aftab ready? Any question from anybody? Please speak out. Okay, Lavanya, if you continue, we'll be very happy. Otherwise, if there's any question, we'll be firing it to you. Thanks a lot. Really appreciate you joining.
Yeah, I might leave soon because, like I said, I have my son's birthday party. So I might leave in a few minutes, but if there are any questions, you can forward them to me later, and I'm quite happy to contact people directly.
A very, happy birthday to your son, Lavanya, from all of us. Thank you. Take care. God bless. Bye.
Okay, take care. Bye.
Yes, Aftab's presentation, please.
Yeah, so we are delighted to have Dr. Aftab Ahmed, MD Internal Medicine with us. He's a consultant physician at Apollo Hospital, Secunderabad, Apollo Sugar Clinic, MetLife Clinic, Medicare Clinic, and he's Medical Director for Apollo Hospital, Secunderabad, HOD, DNB Internal Medicine, author of books published, Revan, Love is Like a Rainbow. We welcome you, sir. We are very happy to have you with us. Stage is yours. So we can't hear you. You're on mute. Yeah.
Hi, you are able to hear me now?
Yes, sir, we can.
Yeah. Good evening, everybody, and thanks for the introduction. So I would start on with the topic, keeping in view the time that we have. So I'm going to talk about one very important clinical condition, which is very painful, distressing, and often depressing. But the good news about this is we have a vaccine that is available to prevent it. All these days, patients used to suffer with this condition and have a tough time trying to deal with the pain associated with this condition. Mostly the antiviral therapy was prescribed, but now with the new vaccine available, we can actually prevent this condition. So I'm talking about herpes zoster. Next slide, please. Now, what is herpes zoster? We commonly call it as shingles. It is a self-limited acute painful condition, which is caused by the same virus that causes chickenpox. We all know that chickenpox is caused by a varicella virus, usually in the childhood. This virus remains dormant in our body. And with aging, as the age goes on and our immunity comes down, the virus gets reactivated, and then it causes an infection leading to painful rash in the skin in a particular distribution. The infection is usually seen after 50 years of age, but it can also occur earlier in people who have immunocompromised states, particularly those who are on certain drugs which reduce their immunity, like steroids or immunosuppressant drugs. It is said that 1 in 3 people in their lifetime will develop shingles. So it's quite a significant number of people during their lifetime can develop shingles. And when it occurs, it usually presents as a painful condition, which first presents with pain and then often the rash. The pain may actually precede the rash, and the rash is usually vesicular eruptions, and they can be very itchy. And usually it takes around 2 to 4 weeks for the rash to resolve. And the pain can actually continue even after the resolution of the rash. And that is the most depressing thing that can happen to the patient, because many patients would actually take around a few weeks, sometimes few months, and even an year for the pain to get resolved. So patients often present to the doctor very often for the pain relief, and many drugs are tried out in this condition, sometimes without much of satisfaction to the patient. Next slide, please. Now, the good thing about herpes zoster is now we have the vaccine available. Some years back, there was a vaccine called herpes zoster inactivated vaccine. But live attenuated vaccine was available, zoster vaccine, which was called as a Zostavax, but it only offered around 50 to 60% protection to the patient. And it was a single dose subcutaneous administration, but it was soon discontinued, particularly in the US, it got discontinued somewhere in November 2020. It's not available in India, and very few countries are having it. But now we have a new vaccine for herpes zoster that is available in our country, which was launched by GlaxoSmithKline. This is called as Shingrix. It is a recombinant zoster vaccine, and it is indicated for all those individuals who are above 50 years. And then also those who might be immunocompromised because of some or the other reason, we can even prescribe them. It is a 2-dose vaccine, and you give the first dose, and the second dose is usually given after 2 to 6 months. And it offers almost around 90% protection against herpes zoster and what we call as post-herpetic neuralgia. Next slide, please. The most common side effects related to Shingrix vaccine, which usually the patients would like to know, is pain at the injection site. There may be a slight pain, tenderness, redness at the site of injection, and a few of them may actually have fever, tiredness, which usually resolves within 48 hours. Otherwise, no significant major side effects related to this vaccine. Shingrix is definitely not studied in pregnant and nursing women and therefore not advised. But Shingrix has shown in various studies that it provides protection against herpes zoster to the tune of almost around 90%. And this protection stays for about 85% for at least first 4 years after the vaccination. Therefore, you can advise Shingrix for all those people who are above 50 years of age, irrespective of whether they had previous chickenpox, whether they had herpes zoster, or even if they had taken the previous old Zostavax, you still can advise Shingrix vaccine. The vaccine is now available in our clinical practice. It's a bit costlier vaccine, but then it is worth it considering the painful condition herpes zoster is. It comes at the MRP of around 10,000 change. 2 doses are required, as I said, usually between 2 to 6 months apart. Now, as I said, herpes zoster is a painful condition, which is often distressing and depressing, but it is entirely preventable. And I would suggest that you prescribe Shingrix vaccine to all those who are eligible. Thank you.
Thank you so much, sir, for quick and very insightful information. And I think definitely people will get benefit from it and will get in touch with you if they need any more information. Do we have any questions here? We don't have it, sir, right now, but definitely we'll get back to you when we have some questions.
Thank you.
Yeah.
Thank
Hi,
you.
sir. Just one question, quick question, sir.
Yeah.
If a patient had shingles, when can we give the vaccine, sir? Like when after resolving, how many days we have to wait?
So we do have patients who had previous history of shingles, and then these patients also can be given herpes zoster vaccine, but you need to wait for at least 1 year. As per the recommendation, you wait for 1 year before you give the herpes zoster vaccine, because the shingles which they got itself will boost their immunity to some degree. And therefore, the gap that you should maintain between the herpes zoster which they have developed and the vaccine that you should give is around 1 year. If somebody has taken a Zostavax, which was an old vaccine that was available, not in India, but maybe in the abroad, the usual gap between the Zostavax and the Shingrix vaccine, which is now available, is 8 weeks. You should wait for 8 weeks before giving that.
Thank you so much.
Thank you.
Thank you so much, sir. Do we have Dr. Sudha in the room?
Yeah, I'm here.
You're here, ma'am. Hello, ma'am. How are you? Yeah. I'll just make you the co-host.
You have my slides?
No, ma'am, I don't have your slides.
Okay. So is it visible?
Yes, it's visible.
Yeah. First of all, let me thank Dr. Ashish for giving me this opportunity. It's a wonderful session indeed, very important academic session. So the topic I would be talking now is about the immunization in thalassemia children. So there are certain factors which one should consider before we embark on immunization for thalassemia children. The age is one important factor, like they get diagnosed at a very early stage, the thalassemia children maybe by 6 or 8 months, the diagnosis is there. Of course, we do have the universal immunization schedule in place, as you have seen by the Indian Association of Pediatrics. And the other important factor is one has to remember that these children would be subjected to multiple blood transfusions, and hence they are prone for any transfusion transmitted infections, particularly hepatitis B and C and HIV and other, very rarely hepatitis A also. And the other factor is their frequent visits to hospitals. So they would be, more prone for many viral infections because of their visits to the hospitals. And it is important to remember that if patients had their splenectomy, their immunization schedule is quite different from those who do not have a splenectomy. So as said earlier, the age, again, normal childhood immunization schedule needs to be followed. Hepatitis B vaccination, luckily now this is a part of the universal immunization program. But what is important for thalassemia children is you have to check the anti-hepatitis B titers, which should be more than 10 MIU per ml to develop the immunity against hepatitis B. So if the titers are less than 10 MIU, then an annual booster injection is suggested for these children. Then hepatitis A vaccination is done. And again, for H1N1, one must consider the annual vaccination for these children. If a child is posted for splenectomy, then prior to splenectomy, there should be a meningococcal vaccine, which is followed up with the other schedules after the splenectomy. I think we have Dr. Sudhir talking to us on meningococcal vaccine. And once the child has the splenectomy, then the child must receive pneumovax from the age of 2 years. And then every 5 years, there should be a booster for the pneumovax. Then again, Haemophilus influenza type B vaccination needs to be done. And of course, we've talked about the meningococcal B vaccine. One must remember that live vaccines should not be administered for these thalassemia patients if somebody is HIV or HCV positive. So this is the information I have about thalassemics and vaccination. Thank you so much.
Thank you, ma'am. Thank you for the information. Do we have any questions here? Okay, okay.
We should
Thank
move
you.
on to another presenter. It was a very fantastic one. Really loved hearing Dr. Aftab and Dr. Sudha. And Garima, who is the next, please?
Dr. Hari.
Dr. Hari Kishan is one of the very finest physicians of the Twin States and obstetric medicine. Is he around? Dr. Hari, are you there?
Yeah, good evening, Ashish. I'm here.
Hi.
Hi.
Dr. Hari Kishan Burgu, my college mate, and one of the very leading physicians in the preventive side also from the obstetric medicine. Over to you. Can we have his intro slide before he starts speaking on the...
Yes, it's already there, sir. He has done his MBBS and then MD DNB, and he's a consultant physician at Yashoda Hospital.
No, it's not showing. It's something else which is showing up. It's not. Yeah, we are not seeing that slide. This slide is specially meant for the would-be mothers or the all the ladies out here specifically. The vaccinations during pregnancy time, which are very much important because not all vaccines can be given. So please listen keenly. Yeah, now it is seen. Go ahead.
Okay, I'm so sorry. Sir has completed his MBBS from Vellore and DNB internal medicine from Vellore. He's a consultant physician, Yashoda Hospital, Samajigura, and Fernandez Hospital, Hyderabad. He's secretary for Society of Obstetric Medicines India. His area of interest are obstetric medicine, HIV, infectious diseases. He's been invited as faculty at several national conferences in the area of obstetric medicine. Over to you, sir. I will just share your slides. Yeah. Is it visible?
Yeah, yeah. Can you put it
Yes.
on full slide mode? I mean, the slideshow mode?
Sure.
F5, please.
Is it good to go?
Yeah, yeah. Can I start?
Yes, sir. Please, over to you.
Yeah, yeah, yeah. Thank you for your kind introduction. Good evening. I think most of you are aware that this is the immunization week, which is being celebrated all over the world. And after what COVID, few things COVID did was like, it has made people aware of vaccines, importance of vaccines, even in adults, like childhood, everybody, we all would have taken vaccines. It's a very successful thing, but not many people are aware of importance of vaccines in adulthood. So why is vaccination important for pregnant women or for that matter, women planning pregnancy? There are two lives at stake. See, for outside pregnancy, you take vaccine, there is benefit to one person. But if a person who is planning pregnancy or a pregnant woman takes vaccine, two lives are likely to benefit. But if a pregnant woman develops an infection which could have been prevented by a vaccine, but if they had not taken the vaccine, then two lives are at stake. Many infections that occur in pregnancy, they may not be much bothersome to the mother. It may be just fever, a bit of cough, cold, body pains, and then it usually settles with just some paracetamol or rest. But it can be very catastrophic to the fetus. For example, rubella. Rubella, usually mothers, they develop fever, some rash, some neck, some lumps in the neck. It's usually not much of a problem for the mother. It usually settles. But if mother develops rubella during pregnancy, they can be devastating effects on the fetus. So similarly, chicken pox, um, also the same thing. You must have heard of Zika. Zika, the mother, they don't have severe illness. They don't have much issues. But if a mother is infected with Zika during pregnancy, and the fetus can have major neurological abnormalities. However, we do not have a vaccine for Zika yet. Okay, effective vaccine for Zika yet. There are some other infections which, if pregnant women develop during pregnancy, when compared to outside pregnancy, they tend to become sicker. Like COVID, if a the pregnant woman develops COVID, they tend to have severe illness. Similarly, just a common cold caused by influenza infection, if a pregnant woman develops it, they tend to be sicker. Hepatitis E is a foodborne infection. Okay, it's a viral infection. They develop jaundice. Outside pregnancy, the risk of death is about like 1%. Some people can develop jaundice, can get sick. But if a woman develops hepatitis E during pregnancy, uh, they the risk of liver failure or even death is much higher compared to outside pregnancy. So we have effective vaccines for influenza and COVID, not an excellent vaccine for hepatitis A. So many have this concern: are vaccines safe in pregnancy? So most of the vaccines are safe in pregnancy. Most vaccines which are inactivated, which are not live attenuated vaccines, they are safe in pregnancy. Even for live attenuated vaccines, the harm is only of theoretic concern. For example, if a mother is bitten by a dog, a street dog, then we must give them rabies vaccine. And we know that rabies vaccine is a live attenuated vaccine, which is generally avoided in pregnancy. There, benefit versus risk. That's what we look at. So even live attenuated vaccines can be given in pregnancy. However, there are theoretical concerns that, if possible, we avoid live attenuated vaccine. But in a situation where it's warranted, for example, after a dog bite, even if it's a live attenuated vaccine, we do recommend it. So generally, vaccines, it's better to avoid in the first 12 weeks. It's called first trimester of pregnancy. Okay. And any pregnant woman, if she wants to take a vaccine, it's better that she discuss with her obstetrician or physician to see if it is safe in pregnancy, what are the benefits, what are the harmful effects to her and her baby. Next slide, please. Next slide, please.
Sir, routine.
Next
After
slide,
this.
please. Yeah, after this.
This one?
Yeah. So the one I talked about, rubella, if outside pregnancy, a woman or a man develops rubella, it's not much of a problem. It's usually self-resolving illness. But if mother develops rubella during pregnancy, and if she's not been vaccinated, for the first time she develops rubella in pregnancy, baby can have a small size head, baby can have a defect in the heart or develop cataract at very young age. Next slide, please. We have an effective vaccine for rubella, MMR, which is part of the standard childhood immunization program. But in case if somebody did not receive uh, vaccine in childhood, they should take this vaccine before planning pregnancy. So there are some vaccines that we offer women who are planning to conceive, who are planning pregnancy, like rubella vaccination, measles vaccination, and varicella, chickenpox vaccination. Because if a mother develops chickenpox during pregnancy, the severity is same as that of acquiring it outside pregnancy. But if a mother develops chickenpox during pregnancy, in the first half of pregnancy, the chance of it affecting the fetus is about 1 to 2%. A baby can have abnormalities. So if a woman has not had chickenpox in childhood, then it's better that they ensure that they're vaccinated for rubella, measles, and varicella before they plan pregnancy. Next slide, please. So what are the routine vaccines that are given in pregnancy? One is tetanus toxoid. Other one is Tdap, which provides protection against tetanus, diphtheria, and pertussis. This Tdap vaccine is given to the mother usually in the last 3 months of pregnancy. It not only protects the mother, but the antibodies will be transferred to the mother during pregnancy, so to the fetus during pregnancy, and then to the newborn via breast milk, and they give protection against pertussis during the first 3 months of childhood, because babies usually receive pertussis vaccine around 6 to 10 weeks, and it takes another 2 weeks for them to develop immunity. So till that period, if mother is vaccinated with Tdap during pregnancy, the baby is also protected. Influenza, I've already mentioned, and this word you should know. You can go to the next. So there is a thing called cocooning strategy. If mother missed her vaccines during pregnancy, okay, some vaccines can be given just after delivery also. So this cocooning strategy is basically the mother and the entire family take vaccines so that the baby is protected, because baby gets infections from mother or other family members. So if all the family members take, you are actually providing some amount of protection to the newborn also. That's called cocooning. That's the end of my talk. Thank you.
Thank you, Hari. That was a very great insight into it. Just from my side, though, I would want to add also, if there is no question. Any question from anybody? If no questions, what's our stand on rabies? I think of late, suddenly there have been too many cases of dog bites.
Ashish, you're asking me?
Yes, I'm asking you.
Yeah. So rabies is, see, everything, whatever we do, it's basically benefit versus risk. Live attenuated vaccines are generally avoided in pregnancy, but to be honest, there is no evidence to say that they are harmful. It's only of theoretical concern. So rabies, you know that if a mother is bitten by, a pregnant woman is bitten by a street dog, okay, then if the dog is rabid and the woman develops rabies, you know that that's the end of the story. There is no treatment for rabies. It is associated with 100% death, fatality. So if a woman develops, it's bitten by a dog which is suspected to have rabies, irrespective of the trimester, we recommend her the vaccine, because there the benefit outweighs risk.
Yep. Thanks a lot. Because of the lack of time, we'll switch over to the next speaker. They say in everything, Ganesha has to be the first one, no doubt about it. This time we have kept Ganesha in between our presentation. One of the very, very finest hematologists of the Twin States, Dr. Ganesh Jayashetwar, is with us. And I would ask him to talk about post-BMT immunizations. So over to Dr. Ganesh Jayashetwar. Any intro slides of his is there, Dr. Garima?
Sir, Dr. Ganesh is an MBBS and
I had
MD.
started sharing the slide deck. Okay, sorry.
Yes. Yeah,
So,
no problem, sir. No problem. You can retain that slide.
Yeah.
He's
So,
MBBS and MD, Mumbai, and DM Clinical Hematology, postdoctoral fellowship in BMT TMC, fellowship in leukemia and BMT from Canada, lead consultant and head Department of Hematology and BMT, Yashoda Hospital, Somajiguda, Hyderabad.
thank you so much for the kind introduction, ma'am, and thank you so much, Dr. Ashish, for this wonderful opportunity. I'm grateful because I can see a lot of my patients have joined to listen about the immunization post bone marrow transplant. So thank you for putting together all these eminent speakers and keeping me by the side of those finest speakers. So I'll start with my presentation. So basically, I'll just take you with a bit of intro slide about what is bone marrow transplant, or to be finest, what is hematopoietic stem cell transplant. So it's a unique procedure that is known to cure not only cancers or blood cancers, but a lot of other conditions which are not cancerous, like various immunodeficiency disorders, immune disorders, bone marrow failures like aplastic anemia, and a lot of metabolic disorders. So what we do in bone marrow transplant, so we use hematopoietic stem cells from a healthy donor, which can be either from the blood, bone marrow, or umbilical cord blood, and then this blood will create a new, not just blood system, but the immune system will be derived from the donor, and this persists for the rest of the patient's lifespan, and that's bone marrow transplant. So this has been this unique advanced treatment modality for the cure of vast majority of blood disorders, blood cancers, has been existent for past 65 years, since 1956. And today there have been more than 10 lakh patients who have been cured or benefited out of this hematopoietic stem cell transplant. So before we move on to vaccination post-transplant, some common misconceptions about bone marrow transplant or stem cell transplant. So many of us believe it's a major surgery like other solid organ transplant like kidney, liver transplant. It's not a surgery. It's a simple stem cell transfusion, just like any blood transfusion, but it comes with a lot of intricacies. And that's why you need a dedicated bone marrow transplanter and a dedicated bone marrow transplant unit. A lot of people have missed that blood grouping matching is essential for bone marrow transplant. It's not so. If it is blood group matching, it's well and fine. But even if it is not there, it is the transplant is not dependent on blood group matching. What is most important is this particular type of gene matching, which is called as HLA gene matching. And nowadays, even half HLA gene match transplants are almost equally successful as full HLA gene match transplant. So particularly a lot of Telugu donors, they are scared of donating the stem cells, feeling that their bone marrow is going to be extracted just like any organ transplants. It's not so. This is just a stem cell collection, just like platelet collection from the donor, and it carries no or negligible risk to the donors. And the most important thing, the bone marrow transplant is the last step in management of blood disorders with dismal outcomes, is a common myth across clinicians, which is not true. In fact, bone marrow transplant is the only curative treatment for vast majority of blood disorders, with a cure rate exceeding more than 80% in vast majority of the cases. So it's no more a curse. In fact, the myth about the cruelty, hopelessness of blood disorders, blood cancers, and bone marrow transplant is not true. Most of these blood cancers, blood disorders are curable in more than 85% of the cases. So coming to bone marrow transplant and the post bone marrow transplant infection. So when you do bone marrow transplant, you actually replace the patient's blood system, immune system with the donor's immune system, and this takes a little bit of time. And during this vulnerable period, these patients are at risk of various opportunistic infections. So not just bacterial and fungal, but viral, parasitic, and various rare disorders. And this is because of the simple fact you can see here, the bone marrow transplant success, what we call, happens in various phases. So the neutrophils which is part of innate immunity, comes back to normal within 1 month. But you can see the T and B lymphocytes, which are humoral and cellular immunity, immune components of adaptive immunity, takes months to years to come back to normal. And that's the reason why we have to vaccinate. This is kind of rebirth. Bone marrow transplant is kind of rebirth, and we have to vaccinate these patients at a specified time intervals post transplant. And because of this immunodeficiency state varying at different time points post bone marrow transplant, these patients are at risk of various infections, bacterial, fungal, viral. I'm sorry for this busy slide, but I just wanted to give you just a gist of impression, so that the kind of infections that happens in these patients. So, that's the logic for vaccination and infection prevention in these vulnerable group of patients. So just like the Telugu cinema suspense Vaikatapakil Bahubali, we should know the logic and the rationales. Now coming to the guidelines, so I will be focusing on Indian Society of Bone Marrow Transplant guidelines for post bone marrow transplant vaccination. This is more or less same for both autologous, allogenic, whether it is full match or half match haploidentical stem cell transplant. So the finer print is here. So pneumococcal polysaccharide vaccine, you can see in the number 2 column in the adults. So it is given at least 1 year post bone marrow transplant, and that there are 2 doses. So 1 dose at 1 year and second dose 10 months after the first dose of Prevnar. And the second one is inactivated influenza. You can see it can be given 6 months onwards, and it has to be given every yearly. So these flu shots for the protection of various viral respiratory infections. Next in line is this vaccination more or less is similar to the vaccination schedule in the pediatric population, because as I mentioned earlier, bone marrow transplant is a kind of rebirth. So you need to train the immune system from these vaccines, so that the patient's immune system produces antibodies, and these vaccine preventable infections can be preventable, most notably the viral infections. And again, you can see the combination vaccines like inactivated polio, H influenza B and DTaP is given 1 year post-transplant and is given in 3 doses, which is at 2 months apart. So 0 to 4 months, starting from 1 year post-bone marrow transplant. Again, hepatitis B and hepatitis A. Hepatitis B is given in 3 doses, 0 to 6 post 1 year of transplant, and hepatitis A 0-6 months, 2 doses starting from 1 year post bone marrow transplant. So in younger females, between 9 to 26 years, the human papillomavirus vaccine can also be given 1 year post transplant. Again, it is just like hepatitis B, which is 3 doses, 0 to 6, and the conjugated typhoid vaccine is given in 2 doses starting 1 year post bone marrow transplant. So with regard to hepatitis A, this vaccine should never be given in the gluteal region. So the vaccines contraindicated post bone marrow transplants are the live vaccines like oral polio vaccine, intranasal influenza, and the cholera vaccine. So these are the vaccines which should be avoided in patients post hematopoietic stem cell transplants. Again, live vaccines which can be given post stem cell transplant has to be started at least 2 years post transplant, and at least when these patients are off immunosuppression, at least 1 year of immunosuppression is the recommended timeline. So MMR and varicella, again, you can see this is given in the 2-1-8 rule, and this is given in 2 doses. So again, vaccine for contacts of the bone marrow transplant patients like children and close family members and healthcare workers. So varicella and inactivated influenza should be given yearly. So with regard to the common question to many of the patients about the COVID-19 vaccination, not during the bone marrow, not just during bone marrow transplant or post bone marrow transplant, but also for various cancer treatment modalities. Like for major cancer surgeries, you should delay the vaccine 1 to 2 weeks after major surgery, after which can be given in the routine schedule as given to normal healthy individuals. And patients undergoing chemotherapy, unless we have to wait until the absolute neutrophil count is more than 1,000, and then after which you can give the normal schedule of COVID-19 vaccines. And patients with bone marrow transplant, we should wait at least 3 months post allogenic stem cell transplant or various immunotherapies like CAR T cell therapy. And even though the slide I projected earlier, the immune reconstitution happens between 6 months to 12 months, but still the COVID-19 vaccination is the only exceptional vaccine which can be given 3 months post-transplant. This is because of the robust clinical trials showing that even though patient don't have the capacity to develop antibodies against these vaccines, but still 50% protection is offered by this vaccination, and the patients developing COVID-19 infection after vaccine is much milder compared to those who develop without vaccination. Again, a patient should receive vaccine whenever available during chemotherapy, targeted therapy, immunotherapy, and radiation. So vaccines, as my previous eminent speakers have elaborated, are very effective, and post-vaccination, definitely it's a natu moment. We can protect these patients from these life-threatening infections. So sincere gratitude. We at Yashoda Group of Hospitals, Somajuda, have completed 300 plus allogenic stem cell transplants, and just like the saying, coming together is beginning, keeping together is progress, working together is success. All these success stories of the patients undergoing hematopoietic transplant is because of the collaboration with all the eminent clinicians on the dais, on this virtual dais, off the dais. It's a collaborative work, so we definitely need to change our approach to offer the best possible chance of cure and survival across these neglected hematological conditions. Thank you so much for your patient hearing. Thank you.
Fantastic,
Thank you so
Ganesh,
much,
as
sir.
expected. You know, it's always nice to work as a team, whether we belong to different organization or not. Majority of my patients post-transplant come for the vaccination from Ganesh to me, and we feel very happy because we all are working in different organization for the mankind. At this time, I will close with few words between this session and we'll move on to second one is giving the right kind of prevention and given the right kind of therapy is most important. And that has to be understood in a way, be preventive and proactive. Be preventive and proactive so that you don't have to be repetitive and reactive. So thanks a lot, Ganesh. Really loved it. Any questions related to bone marrow transplant or for that matter, vaccinations during the transplant? Dr. Ganesh will take it or will request you to put it on the chat box. Now, after hearing so much about what all vaccinations to take, we should also know when not to take. And to talk the same thing, who else but one of the very finest pediatrician, Dr. Suresh, a friend of mine, is with us. He is a pediatric specialist as well as a critical care specialist from Yashoda Hospitals. Very approachable and a very blessed soul indeed, who will reach out to anybody whenever there is a help needed. Over to one and only Dr. Suresh. But before that, I'll request Garima to read out his introduction, please.
Yeah, thank you, sir. Dr. Suresh Kumar Panuganti. He's a DCH DNB Fellowship in Pediatric Critical Care. He's done his PG Diploma in Pediatrics and Child Health from Imperial College, UK. He's a lead consultant and Pediatric Critical Care and Pediatrics, Yashoda Hospital, Somajigura, Hyderabad. He's been a Joint Secretary, Pediatric Intensive Care Chapter, Telangana State. He's been Joint Zonal Coordinator for Indian Pediatric Association, Advanced Life Support Course, Central Zone, authored multiple chapters in various international and national textbooks. We welcome you, sir. The platform is yours.
Good evening, everybody. Thank you very much for the kind introduction, and thanks, Ashish, for getting me on board. So, like Ashish said, it's equally important to know when not to give a vaccination, because we all have heard how important it is to give vaccine and the importance of vaccine in various situations. Now let's know where not to give vaccines. To put it in a nutshell, vaccines are pretty safe. There are a lot of research that happens before the vaccine is introduced into the market. Thanks to COVID, it has made our life a lot more easier to make anybody understand the importance of vaccine. Of late, we are seeing rise in a lot of infectious diseases. New infections are coming up, and increased awareness because of social media and easy availability and accessibility because of internet, and that makes vaccine safety more and more a priority, and it is becoming more and more safer. So there are three divisions which I'm going to talk about. One is precautions, what you need to take while taking a vaccination. Second one is absolute contraindications, that is where you should not be giving a vaccine. And the third one is myths about some vaccination. So if a child has a family member who had febrile seizures or fever-induced seizures, it's better to be safe while taking vaccine. That doesn't mean you should not take vaccine, but be prepared to combat the fever appropriately. And if anybody has a personal history of allergy to milk and egg protein, you need to be careful. And mild to moderate immune deficiency, appropriately if you take vaccine, as mentioned by Dr. Ganesh in the previous one. And hemato-oncological conditions, which was dealt with in detail by Dr. Ganesh, my previous speaker and my colleague. And some autoimmune disorders like SLA and all, when they are in active phase or while they are in relapse but being treated, you should be careful. And any unstable neurological diseases, that is when you do not have a diagnosis as to what exactly has caused the problem, you need to be a little safer. And mild to moderate adverse events to the previous dose of vaccine does not mean you should not take vaccine. A lot of times we see parents, why you have skipped the vaccine? They say that because child has a minor reaction to the previous dose and all. So you should not skip vaccine for that sake. And definite contraindications are if child has developed anaphylaxis, that is a severe form of allergy to the previous dose of vaccine, that particular vaccine needs to be avoided. If there is a known allergy to a drug like neomycin, better to avoid the DPT, IPV, that is injectable polio vaccine, MMR, and chickenpox, because a lot of this vaccine come with a combination which we call it as a stabilizer or a component which keeps the vaccine safer for a longer period. If there is a known allergy to gelatin, better to avoid chickenpox vaccine or varicella vaccine and MMR. If somebody is allergic to baker's yeast, better to avoid hepatitis B, because this vaccine is extracted from the yeast. And in case of known egg allergy, better to avoid influenza vaccine. Of course, there are a lot of newer versions of influenza vaccine which are coming up that can be used after discussing with the pediatricians. And in immunodeficiency state like congenital immunodeficiency, definitely to avoid our live vaccine like BCG, OPV, MMR, and chickenpox. In case of acquired immunodeficiency, similar live vaccines should be avoided, and MMR can be given with caution. And household contacts of immunodeficiency, like Dr. Ganesh mentioned, do not give OPV. This is where we see a lot of them getting into trouble, especially during pulse polio program, because we pediatricians advise everybody should take polio vaccine during this pulse polio. But if any of your household contacts have an immunodeficiency or recently they have undergone BMT, please avoid live vaccine or discuss with your pediatrician. And some of the myths which are very common in Hyderabad, in case of mild to moderate local reaction, for example, after a vaccine, if child develops pain, swelling, and then redness in the local area of vaccination, you should not skip the next vaccine. And any acute illness like fever, cough, cold, do not skip the vaccine. Vaccines are given to protect you from all these illnesses, so do not skip. And another common myth is that you should not take vaccine when child is on antibiotics. That's another myth. Definitive evidence is that you can take with a few rare exceptions. And most important is premature infant. बच्चा पैदा होते बहुत छोटा था इसीलिए वैक्सीन नहीं दिए. This is one common thing which we hear. So this is a child who you should not delay, because this is a child who is at a higher risk of getting infections. Without any delay, this child should follow the proper immunization schedule. And in case of recent exposure to an infectious disease, even if he is in the incubation period, the child should be given that particular vaccine. And in case of family history of seizures, like I mentioned, immunize, but with caution. That is, have paracetamol handy. And some interactions, like if the child was given immunoglobulin for some condition which required that as a therapeutic agent, MMR might have reduced the efficacy. Similarly, chickenpox might have reduced efficacy or higher incidence of adverse events if child is on certain medications like salicylates, which are given for rheumatological disorders. And if child has received immunoglobulin, similarly rotavirus has got reduced efficacy. And if the child is on anticonvulsants like phenytoin or carbamazepine, influenza is known to have reduced efficacy. To conclude, vaccines are biological products that are mainly offered to healthy individuals, and very high standards of safety are guaranteed at every step in production and marketing of a vaccine, because they are under constant scrutiny. And none of these, like anything in medicine, is devoid of adverse effects. In medicine, we keep saying that none of them are 100% effective. Similarly, efficacy cannot be assured in all cases, but majority of them are highly efficacious. To an extent of 90%, some of those vaccines protect. And benefits of vaccine not only extend to the single individual, like Dr. Lavanya mentioned in the initial presentation, but it helps the family as well as the society. And to make vaccination shots less stressful, some tips for parents: do your research, talk to your pediatrician before actually going for that particular vaccine, and ask for a sweet solution. In my OPD, we have this dextrose solution which we give for younger kids, because that makes the injection less painful. For older children, of course, we have a secret candy which we give. And then if you can, that is, if the child is a young infant, breastfeed before the vaccination, so that the child will be a little more comfortable. And ask your pediatrician for a pain relieving ointment or spray. We have some cold spray which makes it little comfortable, and I use equipment called ExoCool, which we apply on the child's vaccination area for 10 seconds before vaccination, so that the child's skin become numb and does not feel pain. And always be honest and calm with the child. Do not say that no, this doesn't make you feel bad or anything like that. Kids are smart in this generation. So take some time and explain them in a language which they understand, that these vaccines are going to make them stronger, in the sense the immunity is going to be improved. Do not lie to them. And bring your child's favorite things. It could be toy, book, blanket, or anything. In fact, I wanted to put a photo of my vaccination room. It's like a play area where kids love to come in and go. And try to distract your child. Now, everybody's mantra is have a phone or a rhyme which you keep so that the child is distracted. That's the procedural anesthesia. And then big kids also need support. Do not think that child is 5 years, so he does not need support when vaccinating. A simple hug or a cuddle or a soft whisper will definitely help the baby soothe after the shot. So if any questions, we are happy to take. Otherwise, you can post it in the chat box. We are happy to answer subsequently. Thank you, one and all.
That was a very, very great session. Suresh, really loved it. We'll be very happy to take any questions, especially this is an important topic to know. Okay, now there is a question from Tanishka Vikran to Suresh. Can Corbevax vaccine be given to 7 years old child having no allergies to previous vaccines during her immunization schedule? Her parents have not sent the child to school since last 3 years, as she has not been vaccinated for COVID-19. In Western countries, as children are also vaccinated for COVID, her parents are waiting for Corbevax.
See, unfortunately, in India, they have announced the vaccination program for children, but it is not yet rolled out in younger infants. And children, when they develop milder infections, they do develop a lot of immunity, but safeguarding them like in a glass house is going to worsen things. What we have seen during COVID, a lot of them were kind of house arrested. When they came out and went to school, they developed severe form of disease, which otherwise would have been a simpler problem. So let the kid enjoy the childhood, let him go to school. These simple minor infections are unavoidable. Let them get it. They become stronger when they get clinical infections, rather than having to go through the vaccination program when it is not easily available in India.
Thank you, sir. Dr. Ashish, you're on mute.
Okay. I think it's important for me to speak it out, especially like COVID has been a big mess for everybody, for the science and everything we have tried. Not letting the child go to school because of the vaccination has not been done, probably, in my personal opinion, is not the right step to contain. Vaccination and getting subclinical infection is same. I know a couple of good number of people who have not taken COVID vaccine. We're not going to go into too much of debate of COVID because absolutely that's a bit controversial here and there. But you should not keep somebody too much in control, especially the child group, unless until your physician has told you or your pediatrician has told you. So my answer to the person who had asked a question, they have not sent the child from last 3 years to go for, I think that probably we all will believe that let the child go to school and get a subclinical infection. Do not send the child if there is some mild cough, some fever, there is some possibility of infection. Whenever there is an infection, remember 4 R's: rest, rehydration, reassurance, and reports. These are the 4 R's which are needed. So please get that word. I hope that helps you out in understanding that.
If I can just add one statement, Ashish,
Yes.
there is a lot of increase in psychosocial effects following COVID because of lack of social interaction. So if somebody wants, they can just Google Dr. Suresh Kumar Panaganti, impact of COVID on psychosocial effects. You will find a nicely written article on that.
Fantastic, Suresh. I think that's very right. And though sir has told in the first only, do Google it. But I would want to tell you one thing. Google whatever your doctor tells you to Google. Please listen to this. This is a very important statement. If you forget the whole presentation, if you remember this only, that will be good for you. Science, technology, Google, and money. Best servant, bad master. Best servant, bad master. So you ask your doctor what to Google, and you will get to the right place. And who else but to tell one of the most, social media savvy, one of the very popular, consultant of South India, I must say, one of the very, health freak, and who's always there, energetically helping us out in the awareness, but Dr. Sudhir Kumar and Dr. Suresh both. So thanks a lot, Suresh, for that wonderful presentation. And I welcome Dr. Sudhir Kumar, one of the top leading neurologists, to interact with us. Dr. Sudhir, are you there? Then I'll ask Dr. Garima to introduce you.
Yes, Ashish, I'm here. I'm ready.
A very blessed college mate of mine from CMC Vellore. We are very happy to see you, Sudhir. Over to Garima for the introduction.
Hello, sir. Dr. Sudhir is MBBS, MD Medicine, DM Neurology. He's been professor and HOD for Neurology Department, Apollo Hospitals, Hyderabad. He has over 125 publications, and his specializations are stroke and neurocritical care. His interests are long distance running and public health. We welcome you, Dr. Sudhir Kumar. The platform is yours. I will just share your slides, sir.
I think let me try. I think it's about to come. Can you see now?
Yes, sir, we can. Please go ahead, sir.
Yeah, sure. Thank you, Dr. Ashish, my good friend, and as I said, my college mate from CMC Vellore. And thank you, Dr. Garima, and the entire team. I think I was listening to the presentations, and I really enjoyed and also learned a lot. And if you are wondering, why a neurologist is talking about vaccination, so it's very important because we are always on the other side. When people get the infections, when they get the meningitis, that is brain fever, then the patients come to us. And it's not a good thing. We take pride in treating them and they get better. But many times the infections can be severe and the outcomes may not be good. So as we all know, prevention is better than cure. And that is what, as I am getting more and more senior, I realize that we have to prevent all diseases. Infections are the topmost. And just like in neurology, we can prevent strokes and other things, but that is not today's topic. So today we'll focus on how we can prevent, meningococcal meningitis, which is one of the important causes of brain fever. So it is a bacterial infection caused by this organism name I have written, not very important for the public. And in the common language, meningitis is basically the inflammation due to infection of the covering of the brain and spinal cord, and also commonly called as brain fever. The common initial symptoms can be just fever, headache, and vomiting, which can be mistaken for any other infection also. But as the infection becomes more severe, then complications can develop, which can be deafness. And hearing is very important, and deafness is one of the common complications of meningitis. And seizures or fits, patients can become drowsy, and severe infections, they can be comatose, and also sometimes paralysis of hands and legs, difficulty in swallowing. So many complications can happen in severe infections. And if you look at the chances of death after brain fever due to meningococcal meningitis, even in the treated cases, it can be up to 5 to 15%. And if due to any chance, if they don't receive the proper treatment, then half the patients can die. So these figures, they tell us that definitely we have to, do whatever it takes to prevent this infection. And if you look at this number, how many people get it? So it is like, 1.2 million or 12 lakhs people per year. So it's not a small number. We all have gone through the COVID numbers. And if you compare with this, and this still kills, even in today's date, about 1,35,000 people die due to this meningitis worldwide, of course. And India is also a common country where we see these infections. And usually the infants and adolescents are prone to get this infection because this is, again, it spreads through respiratory route. And these, at this age, there are higher rates of colonization of the bacteria in the nose and the pharynx. And also in the very early stage, we already heard that Dr. Harikishan was talking about pregnancy vaccination. So some, antibodies come from the mother to the newborn babies, and they are protected against many infections. But after the infancy and adolescents, those antibodies are no longer there. So again, at this age, they become more prone to get this infection. This infection spreads due to close contact between people because it's a respiratory infection. And if they stay together for a few days or few weeks, then the risk of infection is higher. That's why we can see, epidemics of meningococcal meningitis in colleges and army camps where many people live in close contacts for prolonged periods. So how to prevent? So prevention is, one is before exposure. That means those who have never got this meningitis, of course, the method is vaccination. And in India, we have this vaccine, Menactra. So all individuals between the ages of 11 to 18 years, and then at the age of 11 or 12, and a booster dose at the age of 16 years, that's a schedule recommended. And individuals who are 10 years or less, or 19 years or less, with increased risk of invasive disease. So in that, if somebody is traveling to hyperendemic area or area known to have meningococcal disease, military recruits, again, because I told in close contacts, it can spread rapidly. Lab worker who handles this bacteria, obviously he needs to be vaccinated. And those who have asplenia, means they lack spleen, either functional or anatomic, post-pilectomy. So they require this vaccination. And then certain other factors in the blood, if they are present, and those who are receiving treatment with certain medications, they also require. So this is the information for people who have not got infection before, and they are not exposed to infected persons also. But sometimes one can get exposed if the infection is there in some person, and then the as a healthcare worker or as a family member. So close contact is defined as individuals who have spent more than 8 hours of contact within less than 3 feet of proximity to the patient, or the person directly exposed to the patient's secretions during the 7 days before the onset of symptoms and up to 24 hours after starting the antibiotic therapy. So these are the groups of people who can get, who have a higher risk of getting this meningitis. And also close contacts with the healthcare workers who had contact with the patient's secretions. So they are the ones who can be given chemoprophylaxis, which means with the help of antibiotics. And those names are listed there. So of course, so both pre-exposure and post-exposure prophylaxis are available. And I think this is the last slide. And I think we have one more speaker. Over to Ashish.
Thank you, sir, for the presentation. And it was quick and quite informative. Do we have any questions from the audience?
I would actually put it from my side. This is very well known. Thanks, Sudhir. Really loved the presentation, no doubt about it. One of the very, very commonest vaccination, if your child is going to a hostel life anywhere, and especially if you're going to even pilgrimage like Makkah, Medina, and all those things. So meningococcal vaccine is very, very important. And now we want to have a discussion on something very, very fresh, yellow fever vaccination. Anytime you're going to Africa or a couple of 100+ countries, they will be asking you for yellow fever vaccination. And who else but one of the very youngest consultant, Dr. Anwar, is here. Do we have the slide ready, Dr. Garima?
So
Dr. Anwar will enlighten us.
We have Dr.
Yes.
Anwar's presentation here. So it's
Yeah.
my privilege to introduce Dr. Anwar, who's in DNB General Medicine for Care Hospital, Banjara Hills. And he's been junior consultant in internal medicine department in Apollo Secunderabad. Over to you, Dr. Anwar. The platform is yours.
Thank you, ma'am. Regarding yellow fever, it's actually not seen in India. It is seen in some of the next slide, madam.
Okay.
Yeah, it's a viral hemorrhagic fever, just like dengue and other viral hemorrhagic fevers which we come across regularly in our hospitals. So it's a similar infection. And it's caused by a flavivirus, and it's spread by mosquitoes of Aedes aegypti. So it's not seen in India, and it's endemic in some of the countries of Africa, about 30 to 35 countries of Africa, and some 10 to 12 countries of South America. So people who are going to visit these endemic countries, they need to be vaccinated against this infection, yellow fever, because in 10 to 15% of the cases, the mortality is quite high. And otherwise, most of the cases are mild, asymptomatic, or they may have fever, body pains, headache, just like any other viral fever. So the incubation period is about 3 to 6 days. Next slide. Yeah. So the diagnosis of this yellow fever is basically clinical, but there are serological and PCR based assays available in the first week, which can diagnose this infection. And treatment, as in most other viral fevers, it's basically supportive treatment. And usually most of the patients improve well, unless like I mentioned in the earlier slide, 10 to 15% can go into something called as toxic phase, where they develop multi-organ failure, especially with liver and kidney involvement, and they can have poor outcomes. So the treatment is supportive. There is no antiviral agent available for this infection. Next slide. So for the best way to avoid this infection in those people who stay in those endemic areas, and for those travelers who plan to travel to those endemic areas, is prevention. So the prevention is by vaccination or through vector control, that is through mosquito control and avoiding mosquito bites. But one of the best methods available to prevent this infection is yellow fever vaccine, which is very, very highly effective vaccine. And it's a live attenuated vaccine, and it's given in a single dose subcutaneously, and the efficacy is lifelong. But some people may need a booster dose, especially those who have taken vaccine about 10 years back earlier, and now they are in an ongoing outbreak. So in such situations, a booster dose may be needed, but otherwise single dose is sufficient. So as I mentioned, it is indicated in people living in those endemic areas or those who are traveling to those areas. There are certain contraindications for this vaccine. People who are allergic to, those who have taken this vaccine earlier and had some allergy, or those who are allergic to egg protein, they should not be given. Age less than 6 months, organ transplant recipients, people with underlying malignancy, people with thymus disorders like myasthenia, Dijor syndrome, they should not be given this vaccine. People with immunodeficiency, primary immunodeficiency syndromes, in these people also it is contraindicated. Patients who are on immunosuppressant or immunomodulatory agents, for them this is contraindicated. In people with HIV with CD4 count of less than 200, it is contraindicated. Next slide. Next slide. Previous slide. There are certain gray areas like in pregnancy, in breastfeeding, in elderly people, and in people with HIV with CD4 count more than 200. In these people, the risk versus benefit ratio has to be seen, and if the risk is high, then these people also can be given this vaccine. Now, the adverse reactions to this vaccine are they are seen in very few cases, 0 to 0.2 cases per 10,000 doses. So that is very minimum. So otherwise, this vaccine is quite safe. Most of the times, the allergic reactions are mild and they settle down in 1 to 2 days. In few people, especially those who fall in high risk category, elderly and pregnancy and people who HIV with more than CD4 count of more than 200. In these people, sometimes the adverse reaction to the vaccination can be severe in the form of encephalitis-like syndrome, or sometimes it involves different organs causing organ failure. But otherwise, the safety of this vaccination is very high. So it's a very effective way to prevent yellow fever, especially for travelers who are going to these endemic areas. Thank you.
Thanks a lot, Anwar. I think that was a really great presentation on a disease which is very less talked about. So thank you for that. Really enjoyed it. We have very fine consultant from Khammam, Dr. Ranjit Ravela. I'm wondering how come he's so silent. Any question from you, Ranjit, or anybody else? Yellow fever, I have given more than almost 5 to 10,000 vaccinations because it has to be given only by specialized center. If you will be going anytime in future to Africa, take it right now. Obviously, it takes 5 to 10 years of, it needs to be attached to the passport. And it is very much important vaccination to many countries like that of South Africa or South America and Kenya and Nigeria. But what is most important thing is vaccines will work excellent in a healthy person. So these are meant only for the healthy people primarily. Vaccinate before it is too late. Hepatitis B vaccination, when we give it, please remember that, normal time we give it is 1 ml, but when it is a kidney failure, we give it 2 ml. So when the body is weak, we need to have repetitive vaccinations. Anyhow, my whole idea being one of this vaccinologists in the Twin States from last 20 years, I have been practicing this even before the whole COVID had started, that it's all about being preventive and proactive rather than being repetitive and reactive. The final the point for all of you to remember is reach to your doctor when you do not need him, and you will never need him. With these words, I come to the end of our session. I really thank all of you to have joined. A big thanks to Bhuvna, to Dr. Ranjit and Dr. Vasavi and Tulika ma'am from DPS. Any questions anytime, we'll be very happy to take. Thanks a lot for all the speakers, especially Dr. Aftab, Dr. Anwar, and Dr. Suresh, and Dr. Lavanya, not to forget. With these few words, I would give the mic over to Dr. Garima, and any closing remarks from your side. We have Tanishka who's asked a question. I think I will like to bring it out to everybody's notice. Can 4th COVID vaccine be given to elderly persons having comorbidities? It's a very great question, Tanishka. At this time, obviously, different doctors have got a different take. I think I will go a bit, first and foremost, I will combine any vaccination, but I will not combine it with COVID. What do I mean by saying that? I will give pneumococcal in one arm, meningococcal on the other arm, MMR on one butt, and DTaP on the other butt. You can get 4 vaccines in one go, but I will not club anything with COVID. I will give it at least 1 week to 10 days of gap between COVID and other vaccines. That's one thing to understand. Second thing is, COVID, I would go mild. I think I still, personally, I am not going to speak it out on the other way around. Personally, I have a bit reservations with respect to the COVID vaccinations. Rather, if anybody has asthma or who already had COVID, I will tell them to please take a flu shot. Everybody here should take a flu shot, especially the medical reps or pharmaceutical people. Every person, irrespective of age, caste, creed, should take a vaccination, especially the flu shot. Influvac tetra, flu quadri, or fluatrix tetra, all are good. It has to be taken every year for you to understand. And about the fourth booster dose, personally, I have reservations, and I would assure that they are equally vaccinated other vaccines. And that is what my personal call will be. Any different take from any friends, I'll be very happy to have. Dr. Aftab is here. Would you want to take the question? That will be great to discuss.
Dr. Ashish, I too feel that the fourth vaccine right now would not be really good, because the virus that is prevalent right now is not the same as what was originally there. A lot of mutations that have undergone this virus, and most of the vaccines which are available now were originally meant for the virus that we had for the first time. So these vaccines are not really going to help, and the virus is going to escape the. So I don't think so there would be much use of the vaccines which are presently available. They may not be really that much protective against the virus variant that are available right now. The Omicron variants that are there now not really be, the vaccine may not be really able to protect them against these variants. So until and unless we have new Omicron variant specific vaccines that come into the picture and they are studied, I don't think so the old vaccines which are there with us will help us in protecting them.
Thanks, Aftab. Really appreciate that answer. A big thanks to Satish Kannan and whole family to have joined Rajinder Sahabji. Any question from anybody else? We'll be very happy. Looks like Ranjit is busy and Ganesh is also busy too. And we have already overshot our time, but the kind of participation has been great. Thanks to all the DPS family to have joined, because yes, a big salute to all the teachers out here. Whatever the successful clinicians we all are, it's only and only because of the blessed teachers, the ones who have joined here, as well as the one who have made us what we are. So thanks a lot for all the teachers who have joined in. Anything else, anybody, please? Otherwise, I'll ask Garima to close it.
Thank you everyone for joining today. And vaccines are better on arms or thighs? There's a question from the audience.
Okay, let the doctor take a call is what I will suggest. It depends. Say there are few variations are there. Now, who makes a good biryani? The mother or the mother or the wife? Please don't ask a tough question. Obviously, it's kind of subjective, and I want doctors to decide it then and there. Whether intradermal, subcutaneous, or IM, again, there are a lot of people who have personal take on it. Slightly intradermal is better with more immunogenicity, but again, it does differ from here and there. Lot depends on the mass of the patient or the child also. So I think that's an individual call. For all practical purpose, in the children, we give it an anterolateral aspect of the thigh, and on the adults, we usually give it on the deltoid, that is the arms. That's how it goes. So thanks a lot to Satish Kannan ma'am and sir for having asked that question.
So I would
There
like
are some
to
more
take
questions
this
if I get that.
opportunity.
Yes.
No, sir, there are no questions, and we are getting a good feedback. And thank you so much to Dr. Lavanya, Dr. Aftab, Dr. Sudha, Dr. Hari, Dr. Ganesh, Dr. Suresh, Dr. Siddhi, and Dr. Anwar to join. And I think we are good to go, and we will share the recording soon to everyone. Thank you.
We would want you to go to the hashtag Dr. Ashish Chauhan or hashtag Hyderabad Elite Doctors Club or hashtag World Immunization Day so that you will get the link also. Thanks a lot. Take care. God bless. Goodbye. Stay happy, healthy, and smiling always like Garima and us all. Take care. Bye. Thank you, Garima. It was a wonderful job done by you, as usual.